I have recently decided that I have Crohn's disease. I keep waking up with sore fucking guts. Just so I've decided to read this about the Crohn's disease to try and figure out whether I've got Crohn's disease. Crohn's disease is a type of inflammatory bowel disease, IBD. It causes swelling of the tissues, inflammation in your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can involve different areas of the digestive tract in different people, most commonly the small intestine. This inflammation often spreads to the deeper layers of the bowel. Crohn's disease can be both painful and debilitating, and sometimes may lead to life-threatening complications. There's no known cure for Crohn's disease, but therapies can greatly reduce its signs and symptoms and even bring about long-term remission and healing of the inflammation. With treatment, many people with Crohn's disease are able to function well. Symptoms. In Crohn's disease, any part of your small or large intestine can be involved. It may involve multiple segments, or it may be continuous. In some people, the disease is not only in the colon, which is part of the large intestine. Signs and symptoms of Crohn's disease can range from mild to severe. They usually develop gradually, but sometimes will come on suddenly without warning. You may also have periods of time when you have no signs or symptoms. Remission. When the disease is active, symptoms typically include diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, mouth sores, reduced appetite and weight loss, pain or drainage near or around the anus due to inflammation from a tunnel into the skin, fistula. Other signs and symptoms. People with severe Crohn's disease may also experience symptoms outside of the intestinal tract, including shit everywhere. Why not? Sorry. Inflammation of the skin, eyes and joints, inflammation of the liver or bile ducts, kidney stones, iron deficiency, anemia, delayed growth or sexual development in children. When to see a doctor? See your doctor if you have persistent changes in your bowel habits or if you have any of the signs and symptoms of Crohn's disease, such as abdominal pain, blood in your stool, nausea and vomiting, diarrhea lasting more than 2 weeks, unexplained weight loss, fever, in addition to any of the above symptoms. Causes. The exact cause of Crohn's disease remains unknown. Previously, diet and stress were suspected. But now doctors know that these factors may aggravate, but don't cause Crohn's disease. Several factors likely play a role in its development. Immune system. It's possible that a virus or bacterium may trigger Crohn's disease. However, scientists have yet to identify such a trigger. When your immune system tries to fight off an invading microorganism or environmental triggers, an atypical immune response causes the immune system to attack the cells in the digestive tract. 2. Hereditariness. Crohn's disease is more common in people who have family members with the disease, so genes may play a role in making people more likely to have it. However, most people with Crohn's disease do not have a family history of the disease. Risk factors. Risk factors for Crohn's disease may include age. Crohn's disease can occur at any age, but you're likely to develop the condition when you're young. Most people who develop Crohn's disease are diagnosed before they're around 30 years old. Ethnicity. Although Crohn's disease can affect any ethnic group, whites have the highest risk, especially people of Eastern European Ashkenazi Jewish descent. However, the incidence of Crohn's disease is increasing among black people who live in North America and the United Kingdom. Crohn's disease is also being increasingly seen in the Middle Eastern population and among migrants to the United States. Family history. You're at higher risk if you have a first-degree relative, such as a parent, sibling, or child with the disease. As many as 1 in 5 people with Crohn's disease has a family member with the disease. Cigarette smoking. Cigarette smoking is the most important controllable risk factor for developing Crohn's disease. Smoking also leads to more severe disease and a greater risk of having surgery. If you smoke, it's important to stop, because that's how you know if you got fucking Crohn's disease. You don't realize you got it until you stop smoking. It's fine. It makes it all go away if you smoke fucking cigarettes. All right. If that's what's going on. Because I've quit smoking cigarettes. Now I've got Crohn's disease. Now I've realized heroin would really help. Non-steroidal anti-inflammatory medications. These include ibuprofen, Advil, Motrin, IB, others, naproxen, sodium, Aleve, diclofenac sodium, and others. While they do not cause Crohn's disease, they can lead to inflammation of the bowel that makes Crohn's disease worse. Complications. Crohn's disease may lead to one or more of the following complications. Bowel obstruction. Crohn's disease can affect the entire thickness of the intestinal wall. Over time, parts of the bowel can scar and narrow, which may block the flow of the digestive contents, often known as a stricture. You may require surgery to widen the stricture or sometimes to remove the diseased portion of your bowel. Ulcers. Chronic inflammation can lead to open sores, ulcers, anywhere in your digestive tract, including your mouth and anus and the genital area, perineum. Fistulas. Sometimes ulcers can extend completely through the intestinal wall, creating a fistula. An abdominal connection between different parts, different body parts. Fistulas can develop between your intestine and your skin, or between your intestine and another organ. Fistulas near or around the anal area, perianal, are the most common kind. When fistulas develop inside the abdomen, it can lead to infections and abscesses, which are collections of pus. These can be life-threatening if not treated. Fistulas may form between loops of bowel in the bladder or vagina, or through the skin, causing continuous drainage of bowel contents into your skin. Anal fissure. This is a small tear in the tissue that lines the anus or in the skin around the anus where infections can occur. It's often associated with painful bowel movements and may lead to a perianal fistula. Malnutrition, diarrhea, abdominal pain, and cramping may make it difficult for you to eat or for your intestine to absorb enough nutrients to keep you nourished. It's also common to develop anemia due to low iron or vitamin B12 caused by the disease. Colon cancer. Having Crohn's disease that affects your colon increases your risk of colon cancer. General colon cancer screening guidelines for people without Crohn's disease call for a colonoscopy at least every 10 years, beginning at the age 45. In people with Crohn's disease affecting a large part of the colon, a colonoscopy to screen for colon cancer is recommended about 8 years after the disease onset and generally is performed every 1 to 2 years afterward. Ask your doctor whether you need to have this test done sooner and more frequently. Skin disorders. Many people with Crohn's disease may also develop a condition called hidradenitis, suppurativa. This skin disorder involves deep nodules, tunnels, and abscesses in the armpits, groin, under the breasts, and in the perianal or genital area. Other problems. Crohn's disease can also cause problems in other parts of the body. Among these problems are low iron, anemia, osteoporosis, arthritis, and gallbladder or liver disease. Medication risks. Certain Crohn's disease drugs that act by blocking functions of the immune system are associated with a smaller risk of developing cancers such as lymphoma and skin cancers. They also increase the risk of infections. Corticosteroids can be associated with a risk of osteoporosis, bone fractures, cataracts, glaucoma, diabetes, and high blood pressure, among other conditions. Work with your doctor to determine risks and benefits of medications. Blood clots. Crohn's disease increases the risk of blood clots in veins and arteries.
Thanks, Frank.
All right.